And then she brings us back to our foundation, diet. What an impact diet has on everything. And it's so valid because she's got such a poor diet. What role is that playing? It's got to be playing some role.
Across the board.
Across the board.
Right. Well, I think too, to your question, when you don't know which comes first, the chicken or egg, just going back to the fundamentals in all ways, trying to help her to exercise regularly. So we got to help her foot, or trying to, even though we're unraveling the cause of her in sleep and her fatigue, for the moment, maybe we're just going to give her a drug to help her sleep, so that then she can have the energy to exercise and to eat and to cook and to eat better. So sometimes this is where just a pharmaceutical comes in for me, is sort of a short-term fix or even a preventive medicine issue while we are kind of fleshing out and working on the bigger picture. But I think fundamentals in all ways for her: stress management and nutrition and exercise and fresh air. And then the other thing that I do sometimes when I just, it's confusing to me whether to stimulate or to suppress, so to speak, or inhibit some mechanism, is just that I love that we have these adaptogens and tonics and just things that are just nourishing, whether in the plant world is robust in that area.
Absolutely. We'll come back to that. I just want to point out that this is a beautiful discussion for lots of reasons, but one is that we're all talking about so many different factors that connect and can create this picture of ill health. Just to remind us, this woman presents with a visibly enlarged thyroid. So the tendency for clinicians is to focus on the thyroid and do everything we can to shrink that thyroid, but I think that having the luxury of maybe her not sitting here, but also just really thinking about it, allows us to see underneath that and really getting at some of the contributors. So I think that's really important. Speaking of that, nobody's mentioned this odd parasitic fish, parasitic, I don't know, fish poisoning, and I'm curious about this.
So my thought perhaps was just another contributing factor of her proposed iodine deficiency is that that event created a fear of actually taking in ocean products, whether they be fish or seaweed or what have you, that of course, more rich in some of those nutrients. So I thought perhaps that contributed to the deficiency along the line.
Interesting. Yeah.
I would have never thought of that. That's a good thought.
It sounds like she had a pretty severe reaction, so I think I would have been scared.
Yeah.